game changer in pandemic. So if we allowed misinformation about the current trials of COVID-19 vaccines to prevail, it will be endanger completely our ability to respond effectively. The anti-vaccine campaigns are questioning the safety of vaccines for Africans, and this is detrimental for the current response efforts. So again, let's work collectively with all of you, especially the media, to fight this misinformation campaign. You all recall that on the 24th and 25th of June, we held a very successful conference on COVID-19 vaccines with the theme Africa's leadership in the development and access to COVID vaccines in Africa. And this was very successful. There were over 3,000 people that were registered on the Zoom platform, with another close to 300 people on the YouTube and Facebook media. As an outcome of that meeting, the African Union has now established, through the Africa CDC, a consortium for COVID-19 vaccine clinical trials, in abbreviation CONVACT, CONCVACT, to oversee vaccine trials on the continent. This is very important. The spirit of this consortium is that it brings together all the expertise that exists on the continent so that we can act in a coordinated manner to ensure that vaccine trials are conducted appropriately on the continent. And the consortium will also allow us to engage with the vaccine manufacturers across the world to identify those leading candidates that can actually go into clinical trials on our continent. It will also become a platform that will engage with other discussion, like the COVAX, that Gavi is leading to negotiate Africa's position on the world stage for this vaccine access and development. I want to assure the community through the media that Africa CDC, through this consortium, that is the CONVAC, will ensure that vaccine trials are done on the continent in the most safe, appropriate manner, using established methods. Let me now transition and end with the work we have been doing over the last couple of weeks to continue to support member states to build their capacity. We've conducted several in-country training programs in Nigeria and South Sudan for infection prevention and control. We've training several member states on biosafety and biosecurity measures related to COVID-19, especially in East Africa. And training has been done for the use of gene expert machines for COVID-19 testing across the continent. We have also begin to conduct trainings on clinical trials in Africa, with about 375 participants attending, and 295 of them were all from Africa. So that is very important, so that we'll begin to make sure that clinical trials, understanding how clinical trials is done is very, very important. At the end of June, 4,000 participants from 45 countries, member states, were trained on infection prevention and control, and using 23 webinars and 17 online forums that was established. So I think that is, I'll end there and Wayne, and turn it back to you for the question and answer session.
Thank you very much, John. And thank you for highlighting the facts that you've taken us through. For example, that the pandemic is now gaining full momentum. We are all seeing those numbers keeping going up. And thanks for your continued advice on how we can deal with this issue. Now, colleagues, we will go on to your questions, and I'm receiving your questions via my WhatsApp number. The first one is coming from Bibi Aisha with the British Medical Journal. And Bibi says, Dr. Nkengasong has said, and this is a quote, "Hospitals are so overwhelmed with COVID-19 cases that they are redirecting medical staff running short on supplies, and suspending other key health services. Then the question is, could you elaborate on this, please? Which countries have health systems that are overwhelmed? And could you provide an overview of the situation? That's the question from Bibi Aisha from the British Medical Journal.
No, thank you. Let me just address this way. I don't recall that I have made such a general statement about the hospital system being overwhelmed with a redirection. But we expect that as our pandemic gathers speed and countries, as I indicated, the top 5 countries, there is South Africa, Egypt, and other countries begin to record this extremely high number of cases, that hospital systems will be overwhelmed. That is not new anymore. That is something that is happening already. South Africa, we know, has converted the conference center in Cape Town into makeshift facilities for hospitalization of patients, and we'll continue to see that as the pandemic expand. That is why we're very cautious and very deliberate in making sure that our PACT strategy, that is the partnership to accelerate COVID testing, had 3 underpinnings. One was to test, to trace, and to treat. We use the word treat very deliberately because we knew that as a pandemic would expand, that there will be need for hospital systems to be able to accommodate, or countries should ensure that hospital systems can appropriately accommodate patients. So I think we will begin to see increasingly that I would call on countries to take that into account and anticipate that these scenarios will happen.
All right, thank you. The next question is coming from Joe Foster from the German press agency. The health minister for South Africa's Gauteng province says that they are preparing thousands, possibly up to 1.5 million grave sites due to the increase in coronavirus cases. Do you think this preparation is necessary and realistic?
I think it's always good to prepare for the worst case scenario, and take appropriate measures and expect the best, but always prepare for the worst case scenario. I think we encourage all countries to be thinking ahead, and in many aspects of the pandemic, what I call the entire spectrum of the pandemic, from prevention to through deaths and prevention of harm to our general healthcare systems. So there's absolutely no harm to think ahead of what can possibly be a worst case scenario.
All right, thank you. Next up, we have a question from Sophie Mkwena, and she is the SABC foreign editor. She has 2 questions. The first one is, how many African countries are participating in COVID-19 vaccine trials? Then the second one is, the US pulling out of the WHO. How will this affect the fight against COVID-19 and other diseases? Those 2 are from Sophie Mkwena.
No, thank you. I mean, there are 2 countries that are currently participating in COVID vaccine trials, that is Egypt and South Africa. As I said earlier, with the new initiative we are launching, we will seek to engage many more countries so that we can do that in a coordinated fashion. A continent of 1.3 billion people deserve more than just 2 countries participating in COVID vaccine trials. With the United States withdrawal from WHO, I think I've said this before, that the world has always been in a better place when the WHO has exercised leadership, and very importantly, when the United States have exercised leadership. And clearly, and we've seen that with several instances for the HIV/AIDS pandemic. The United States leadership through PEPFAR has been extremely important and a game changer early on in 2002 when the United States government decided to provide an increased number of resources funding to fight the pandemic in the areas of malaria, in the areas of polio elimination, and many other areas. So I think the world continue to expect that the United States will show that incredible leadership in global health issues as they've done in the past.
Thank you very much. Colleagues, can I just remind you of how you can put in your questions? You have two alternatives. One is to use the WhatsApp number +251 9455 02310. I'll take that number again, +251 9455 02310. Those of you who are on the Africa CDC WhatsApp media group, you can also send in your questions that way. And then the other way is for you to join us live, as we are about to do. We've got George Oboluta, who is online. George, hello.
Hello.
Hello, George. Good morning. We can hear you very well. Please go ahead with your question.
Yes, I'd posted it, but I can ask again. That given the numbers of rising cases all over the continent, what advice would you give to countries that are reopening their borders, especially on quarantining new arrivals?
So we have issued guidance, again, if you recall, George, on how to unlock or ease the unlocking safely. I think that's the key word there. I think we have, it's very, very clear that countries need guidance. They should just go to our website and see what we've established there. Unlocking safely is very, very important. I think this is a serious disease. It deserves to be treated seriously. And I think making sure that we have a coordinated approach in opening up our borders will be very, very important. As we will be issuing an extra set of guidelines this week on airport, opening of airport and travel through airports, and including regional coordination with cross-border issues there. So I would say that countries should also watch out for, by the end of this week, on new guidelines that we'll be issuing to them.
All right, thanks. Thank you, George, for your question. We move on now to David Pilling of the Financial Times. And David says, the first question, what information do you have about the prevalence of asymptomatic cases of COVID? I take it that this is on the African continent. And then he asks, how does this compare with international rates? This is question one. He has a second question. What can you say about the median age of COVID fatalities in Africa? And again, how does this compare internationally? Those are the two questions from David.
So thank you, David, for those very important questions there. There are several studies that are still being conducted across the continent to understand the exact percentage of asymptomatic COVID patients. But what we understand from anecdotal encounters is that there are so many young people that are infected, but they are asymptomatic on the continent. Again, these are all related to us, not based on specific studies there. So we have to be patient a little bit for these studies to be concluded. So that we can actually know that. I mean, we know that on several occasions, we have had discussions with folks from Kenya and other countries, and they say, look, in quote, we see these young people running around with COVID, including Ethiopia. I mean, with COVID-19, they are diagnosed, but they just are living their lives normally. So I think that we need to back this up with appropriate studies. To hopefully in the coming months, we should be able to have that. The case fatality, as I indicated earlier, if I can just go back and read what I said, is about 2.3%. But however, there are some countries that, 7 countries that have a higher than the normal global case fatality rate of 5%. So I think that's what I can say on the case fatality. That our number is it seems low, but some countries are reporting high numbers that are more than the global median.
All right. Thank you for that. We have Peter Fabricius, who is online. Good morning, Peter.
Hi, can you hear me?
Yes, we can hear you very well. Please go ahead.
Good morning, Dr. Kansong. Thanks again for your briefing. I just want to ask you a question about vaccines. Do you think it's necessary for Africa to be conducting its own vaccines in order to ensure that it gains access to vaccines when one is discovered? I mean, I think it's probably, it's probably most likely that a vaccine will be discovered somewhere else, I would guess, just because of the huge amount of resources that are being poured into it, for example, in the US, probably in China and so on. Is that a factor? I mean, whether or not we produce one ourselves, what is the strategic thinking around having our own vaccine developed in Africa? Thank you.
No, thank you, Patrice. I mean, we are encouraging the consortium that I just indicated is designed to promote the development of clinical trials on the continent, not necessarily the development of vaccines. We have to look at the entire issue related to access to vaccines. One is in the manufacturing, that we will be needing about 7.8 million, requiring about 7.8 billion people vaccinated in the world. So having production at that scale, it will be a historic moment. We've never, in any case in the world, have 7.8 billion people in need of vaccines. So having production sites in Africa that can scale that up, not necessarily doing the R&D for vaccines, but scaling up that production, it will be very, very important. We have sites in Senegal, Egypt, and other places that already produce vaccines, like yellow fever vaccines in Senegal. So there's intellectual property transfer. Those sites can actually, I believe, ramp up production for the continent. I think that is one. Second is that, yes, the vaccine candidates, and I use the word candidates here very deliberately, are being produced out there, but having that trial conducted on the continent will build that community relationship and the trust, and also make sure that with the community own.
Disconnected again. So take it off again.
Owns that. So that I think it's very important that we do that as part of building.
Jamal, you need to go and sit over there and operate.
In the community.
All right. I'm not sure if you can hear me. John, can you hear me? Hello?
Yeah, I can hear you. Can you hear me?
Wonderful, wonderful. Thanks. We have another question that came in from Sophie Mkwena, and she says, can you give us information on the deployment of Cuban Medical Brigade in Africa?
Unfortunately, this was about the deployment of Cuban medical...
Of the Cuban Medical Brigade.
Unfortunately, I don't have that information for now. We will be take that as to suggestive that there are some deployments, and we'll investigate that, and hopefully next week be able to provide the appropriate answer.
All right. Okay, thank you. Cara Anna with Associated Press. She says, One of our medical writers has interviewed Gavi CEO, Seth Barkley, and he dismisses the idea of a people's vaccine for COVID-19, saying that it makes no sense and vaccine makers would walk away. Do you think Gavi should push harder on intellectual property issues and insist on suspending patents? That's from Kara.
Yeah, I think we're faced with a global crisis that requires global solidarity. And we've also stated in our statement, a communique we issued after the vaccine conference on June 24th and 25th, that there's absolute need for intellectual property that we look at carefully, because we want to be sure that we don't find ourselves in the 1996 scenario where HIV drugs were available, but it took almost 7 years for those drugs to be available, to be accessible on the continent of Africa. And because of that delay, so many people died, HIV-infected people died. So I think if a vaccine is available and we have a delay in Africa of even 1 year, that would be catastrophic for our continent. So this is where the urgency is, and where we should really express that solidarity that we've all been talking about. So the concept of a people's vaccine is around, is a call to action for global solidarity at a critical time where the world actually needs one.
All right, thank you. Let me just remind colleagues again of our WhatsApp number for your questions. It is +251 9455 02 and that also applies to any people who might be watching us on our Facebook and our live stream. +251 9455 02 We now have a question from Michael Omare from Tunacheki. What is the Africa CDC's take on the reports from leading scientists all over the world that COVID-19 is now an airborne infection?
I think we need to clarify that statement about the airborne infection. I mean, we know that COVID-19 has been is a respiratory disease, and it's caused by transfer of droplets. So I think the distinction between that is very important with airborne. When it's droplet, it means that it's to be infected. You have to say sneeze, cough, and then the virus is found in that liquid that is transmitted from the individual coughing or sneezing to the next person then. If it's airborne, it means it's just, if somebody was to sneeze here, it can float around the air for a couple of hours and so. So I think there's a big distinction there between being an airborne and a droplet infection that is that is based on droplets there. So I think we don't have evidence for that this is not a droplet or respiratory disease. I think we continue to treat it as such. But the airborne means, of course, that you can get it where if somebody sneezes, cough, and the surface is contaminated, or you're within a certain number of meters away from that individual, you can actually inhale that. That's why wearing of masks is so important. We're encouraging that it should be a universal practice on the continent now. Again, let me say this, whether it is droplet associated or airborne, we should all be masking ourselves. I mean, Dr. Tedros used to say, test, test, test. I would say mask, mask, mask. This is the time for us to try to achieve 100% mask wearing, especially when we get into places that are congested.
Thanks a lot, John. We have a question now from Anthony Jongwe, and he says, will not the withdrawal from the WHO by the USA impinge negatively on the good work of the Africa CDC, and that is in terms of budgets? So he's basically asking, the withdrawal from the WHO by the USA, will it not have a negative impact on the work of the Africa CDC budget-wise? That's from Anthony Jongwe.
Yeah, I think I've said, let me respond this way, that it's not about Africa CDC, it's about all of us. And when WHO is strong, all of us are strong. And when the United States government's leadership is strong, all of us are strong. I think we are in this together. So I would not necessarily respond in terms of our budget and the United States government's withdrawal, but rather that this is time for us to see more leadership across the world from the United States and from all nations so that we can fight and win this war. We are at war with this virus. I mean, look at the numbers. In just 6 or 7 months, we've had more than 11 million people infected in the world with over 600,000 deaths. And we've not seen that in the last couple of probably in the last century. So I think we should take this seriously, and only leadership, effective leadership across the board will help us to fight and win this important battle, which we must win. This is a battle about our future. This is a battle about our development.
All right, thank you very much. I believe that we might be having more questions coming in, but while we wait, because I see the producer is typing in a question into my WhatsApp chat, while we are waiting for that question to come through, do you think perhaps you could just take us again through that increase in the numbers on the continent of Africa?
Yes, we, as I indicated earlier, as a continent, we've recorded 518,650 cases of COVID-19. So we've crossed an important milestone of 500,000 cases on the continent, with about 12,000 deaths across the continent, with a case fatality rate of 2.3%. That is huge. Very important here as well is to look at these numbers, that is the caseload by region. There are some regions, like Central Africa region, that is it will appear to be least affected, but then also the number of the testing in that region is also very limited. And we are doing everything possible to ramp up testing within the Central Africa region. South Africa's cases, if you look at Southern Africa as a whole, it provides a very interesting dynamics, where South Africa has the largest burden of 215,000 cases. But then you look at other countries like Namibia, Botswana, Eswatini, Lesotho, that have very low numbers, and Angola. So I think it's a very interesting dynamics. We ought to learn what is keeping these numbers low, what these countries are doing to keep their numbers low, and so that we can derive lessons from them and share it across the board. We also have to understand more what is driving South Africa's rapid increase in the number of cases as much as possible, because again, we are just, this is a new virus, and we've lived with this virus for only about 5 to 6 months now.
All right, thank you. We will go online now to take a question from Chiamaka Okafo, and Chiamaka is with Premium Times of Nigeria. Good morning, Chiamaka.
Good morning, Winnie. Good morning, Dr. John.
Good morning. Morning. Please go ahead with your question.
Good morning.
Okay, so a laboratory in Nigeria led by Professor Christian Happy sometime in June announced that they had developed some rapid test kits for COVID-19. So my question is, how is the Africa CDC capitalizing on such development to boost testing in Africa?
No, very good question. I think we as Africa CDC are actually encouraging all manufacturers of the diagnostic tests on the continent to work very closely with us so that we can assist with issues related to endorsing the tests or doing proper validations, independent validations. The key word there is independent validations. We have, I'm in contact with Professor Christian Happy to work on to find ways that we can work on and advance that test. We're also in contact with Senegal, the Institut Pasteur in Senegal, We are in contact with the manufacturers in Morocco, where they've developed a PCR-based test, a polymerase chain reaction-based test for COVID, and we're also in contact with the KEMRI in Kenya. So we are on top of this, and our role is to facilitate an independent validation of this, because our made in Africa products must ensure that they perform just as well as any other product in the world. And I have absolutely no doubt that these groups that are producing those tests will produce a very reliable test kits that can be used in Africa. And we are looking forward to the day that these test kits will get into the platform. That is the African Medical Supply Platform.
Thank you. We now have George, and I understand George has 2 questions and he's online. George, good morning.
Good morning again.
All right, please fire off your 2 questions.
No, it's a second one. That's one already.
I see.
But it's just what is Africa CDC's comment on the change in approach and tone to the COVID-19 pandemic in Burundi, which has in recent days increased testing and measures to control its spread, and this, which is a far cry from previously when former President Pierre Nkurunziza was in charge.
No, George, that's a very good question. I mean, in other conversations in this forum, I've actually insisted on the need for leadership. For that leadership is a critical, good leadership. It's a critical component in fighting the COVID pandemic. And I have, in several instances, really applaud the leadership of the chairperson of the African Union Commission, Excellency Musa Faki Mahamat. I've also highlighted the important leadership role that President Cyril Ramaphosa, in his capacity as the chair of the African Union, continues to play to rally the continent together to fight this as a continental battle. So just to highlight that leadership is critical. We also know that of the 6 elements or pillars of health system strengthening, leadership and governance is one of them. So it's not by chance that those leadership and governance is a key component of health systems strengthening there. So we really applaud what we are seeing in Burundi, the leadership that is going on there. I think, again, let me repeat myself. This is a serious virus. It's a deadly virus, and we have to take it very, very seriously for the interest of our own future and for the interest of our development.
Thank you very much. We now have a question coming from Ryan, and Ryan is with the South Africa Daily. What do you say about South Africa reopening schools while the number of coronavirus cases is rising every day? What advice can you give to the South African government regarding saving the academic year 2020? And do you think it is worth saving the academic year? Those are questions coming from Ryan from South Africa.
So Ryan, I think our position is very clear that we have to, it's not a question of saving lives versus saving livelihoods, and schools are part of livelihoods. We cannot keep our children at home for forever. However, we have to make sure that this is done safely, that this is done with the most appropriate measures in place, with the social or physical distancing as much as possible, with the appropriate masking. Again, as I insist, we should really ramp up our mask wearing campaign, and again have a slogan where I would call for a mass approach, and that should include in schools as well. So I'm sure that South Africa's government has developed guidelines on how to open schools safely. We will, as Africa CDC, also be issuing guidance on how to reopen schools safely. If you notice, I've used the word safely several times in this short statement, just because we know that we cannot do this like just suddenly ask children to go back to school without putting in place the appropriate measures. And they should be evaluated, as we indicated in a guidelines document that we published some weeks ago, that on a safe reopening of our system, that this should be looked at every 2 weeks or 3 weeks to measure the effect of what, if these measures are adequate there. So in summary, I'm hoping that guidelines have been produced by the government of South Africa to all schools, and all schools should adhere to these guidelines, and they should be done in a very thoughtful, safe manner, so that as children are not infected when they go back to school.
Thank you very much. Our next question is also from South Africa, and this one is from Dr. Fred Molelekwa, and he's in South Africa. And he says, "Good morning, Dr. John. Song, you have indicated that 7.8 billion people would need COVID-19 vaccine. What is your take on people with disabilities taking part in the vaccine trials? Should they take part or not?" That's Dr. Fred Molelekwa from South Africa.
Yeah, I mean, that's the whole purpose of vaccine trial, is to tease out and understand how the community will react to that reaction, meaning that their perception, understanding, and uptake of that. Vaccine is a complex issue. I mean, even for those vaccines that are already available, are commonly available, the uptake in some countries or in most countries is never at the level that we should expect. So we don't see the COVID vaccine being anything different. I think we have to bring in socio-behavioral scientists to help us understand this. We, as Africa CDC, as part of this vaccine consortium that we've launched, is conducting a large-scale study to understand perceptions, attitude, and beliefs around vaccines on the continent. And that study, we hope, will start very, very soon. We are concluding the necessary protocols, and I think that will inform us more on our uptake processes for vaccines on the continent. So in short, but the intent of the vaccine trial is not just to demonstrate safety and efficacy, but is to understand the community, how different sectors of the communities, including the disabilities, will be able to react to vaccines.
Thank you. Justin Hango from Namibia. How does a small population sell testing kits to Botswana when we ourselves need to do more testing? Why has Namibia only tested 10,000 people since the pandemic started? That's from Justin Hango, and he says, thank you very much for sharing the answers with us today.
So the question was why Namibia has tested only 10,000?
Yes, he seems to have two questions. The first one being, how does a small population sell testing kits to Botswana when we ourselves need to do more testing? And then he goes on to say, why has Namibia only tested 10,000 people since the pandemic started?
So let me say that, I mean, with this, because of internet connectivity, that I heard the beginning of the sentence and then I didn't hear the whole sentence. So it's, if you don't mind repeating that, when.
All right, okay. Let me try to interpret the first question. I think that he's asking how can they need to do more testing. And I think he's intimating that they don't have enough testing kits in Namibia. Mm-hmm. And then he goes on to ask, why has Namibia only tested 10,000 people since the pandemic started?
Yeah, so, I mean, good, thank you. I think that I get a question. First of all, let me say this, that access to testing should not longer be an issue to any member states on the continent. As a matter of fact, I was asked that we work closely with the media to ensure that countries are aware that the African Commodity Platform is ready. and up and running, and many countries are using it. So you can go there. There's a quota that Namibia has that has been assigned for Namibia, and just as all member states in Africa, that they can buy the appropriate quantities of test kits. So I think again, let's go out there and share the information and share the link with all member states, so that the issue of access to testing should no longer be a problem. It becomes a question of how can you test smartly, which means it's not just general population testing, but testing targeted population and targeting our testing strategies there. So I think that is very, very important. If you look at the numbers in Namibia that are relatively low, I think less than 500 cases in about 500 cases in Namibia. It means they're doing one of those countries that I believe are doing something right, which we should also be finding out what is it that they are doing right to keep their numbers that low, and learn from that and maybe extrapolate such experiences across Africa. So again, my take on that question is that to all member states, please use the platform to procure your testing needs. They are available, the quota is there. It is up to countries to use that platform to meet their needs, testing needs as much as possible.
All right, thank you. And if I can just complement what you've just said, to inform colleagues of where they can find that information, colleagues can look up www.africacdc.org. You will find all the information that Dr. John is referring to. We move on now, in fact, back to South Africa from James Makame. 2 questions. The first question is, on the treatment front, how close are we in getting an effective cure or drug? How critical or effective is remdesivir? Do we have any clinical trials of potential candidate drugs, not vaccine trials, currently going on in Africa? And if yes, at what levels of development are they? So I think I'll let you answer that first question because it's quite detailed before we go into the second one.
Yeah, no, thank you. That's a very good question. Yeah, I mean, let me start with the last part of the question, which is about clinical trials for drugs going on in Africa, not vaccines. I think that's, the last time that I reported on this, there were over 29 trials going on, and that number might have changed and with an increase, but that it just shows that there are many more countries that we're doing clinical trials, what I call registered clinical trials on the continent, and using all kinds of combination of drugs, including hydrochloroquine and other. Remdesivir is, we know, has been published that it's not a magic drug. But we know that it really helps to reduce the number of days that patients are hospitalized, especially those requiring ventilators, hospitalized, but it's not a magic drug yet for our people. So we still have to wait to have an effective drug for that will be considered as a more effective treatment or cure for COVID-19. In short, there's no cure treatment, no drug that cures the individual. That is, like I would say, compared to malaria, where you can go to the pharmacy and buy a drug that will knock off your malaria in 2 or 3 days there. So again, it's a field that we are watching carefully, but very encouraged that multiple clinical trials for drugs are taking place on the continent of Africa.
Question 2 from James Makame. On the vaccine development front, how stable is coronavirus WRT mutations? If it's highly mutative, will this not negatively affect both drug and vaccine development?
So we have that's a very
seem to have lost that feed. That of course being from the Africa CDC update, of course spelling out how the COVID-19 is impacting the continent of Africa. As you can see there, South Africa and Egypt, only 2 African countries currently doing COVID-19 vaccine trials, and that was the answer that we're expecting to hear there from. In fact, my director tells me that Director Nkenga Song seems to be back. I'm going to listen up. Yes, do we go back to the webinar? No, not yet. It seems that we do not have those, the lines up. They seem to have dropped. Let's take a quick break. Hopefully when we come back, we'll try and get our lines